guys, I'm Boko Emanuela Ifeima. I'm here to advocate on this case, failure to thrive in a 2-month-old baby. So what is failure to thrive? Let's start with the definition of the term failure to thrive. It simply means lack of expected weight of a child, or lack of growth, developmental milestones and growth of a child as equate with his age. So let me just bring it down to a layman's explanation. Failure to thrive is inability of a child to assume the exact weight of his mates. Like a child of this 2 months is meant to have gained weight to an extent that it must be triple to his birth weight. But when this baby does not get up to half of the expected weight, it will be diagnosed of failure to thrive. So let's come down to the causes of this failure to thrive. What can actually cause this failure to thrive? So many things can cause failure to thrive, which is mother's emotion. Maybe the mother is depressed, or any other thing can make the mother not to take care of the baby. Maybe he's abused, domestic abuse, he does not feed well, he's being beaten, he has emotional problems, or he has a disease condition that is actually affecting him. He has so many things that he doesn't want to share with somebody, or maybe it has all these long-term diseases that couldn't be treated, or neglect from the family, maybe unwanted pregnancy, mental trauma, physical abuse, poor feeding habits, poverty. That is the real causes of failure to thrive. So who are the risk factors of this? The risk factors of this are children that has this condition: Down syndrome, cerebral palsy, heart diseases, milk allergy, infections, celiac disease, cystic fibrosis, acid reflux, or heart diseases. These are the children that are at risk of developing these diseases. So what are the symptoms of this disease? In case if you see it somewhere, you can easily say this is failure to thrive. This child is exhibiting failure to thrive. We have lack of weight gain, we have delay in reaching developmental milestones with his age, we have learning disabilities, we have low IQ, we have delayed motor development, we have fatigue, irritability, delayed puberty, lack of emotions like smiling, laughing, making eye contact, and the rest of them. And how can it be treated? The only way it can be treated is by bringing this child to the hospital. In fact, the first step is for a mother to observe that this child is not as normal, as others, is not in line with the children of his age. The ability of this mother to recognize that is the first step, because some mothers are not observant to recognize such. So the mother should bring the baby to the hospital, where this baby will be thoroughly examined with lab investigation to note the actual reason for not gaining enough weight. And if, like our patient, the problem was not severe investigations and the rest of, they have to do genetic testing and found out that he has issue with the adrenal cortex. So that is the reason why mothers should be very observant. So what am I advocating for? I would like to advise the mothers, because the mothers sometimes they don't normally pay attention to their baby, they don't normally give that wow attention to their baby. The mothers out there, you should always observe your child from birth, even from having your child in the belly. You have to know the type of things that you eat and your child will react to, so that you will stop that. You also go to the hospital, antenatal care, for investigation to make sure that your baby is in good condition. Always be at alert to know when your baby is having issues. So some mothers out there with babies of failure to thrive may be having some psychological problems. See, after carrying the baby for 9 months, yet baby is now giving me problems. So we should be able to help this mother to achieve a good weight to a good aged baby. So I hope that mothers out there have learned so much from this advocacy, and thank you so much for tuning in. Bye bye.